And joining me now is the Chief Medical Advisor for Area 9 Lyceum, an education platform, Dr. Claus Biermann. Thank you so much for joining me.
Thank you.
COVID-19 has definitely accelerated e-learning, but still there's lots to learn. What is the best method from your point of view to go forward?
I think what we learned today in this session is that there is a huge burden of personal shortage. And on the one hand, and on the other hand, that the type of learning we were doing for the last 30 years is more or less over. So that means e-learning, this typical blocked learning, is moving into personal learning, which means that people are learning what they need to learn, that they get a kind of personal tutor by a platform, and that they learn to assess themselves. And this, I think, was an important outcome today, that self-assessment as part of the whole story is quite important. So we are talking about the future of learning, we are talking about the future of education, which is not only based knowledge, it's about skills and character, and these combined with self-assessment and metacognition.
So self-assessment is one buzzword and the other is adaptive learning, I've taken. Can you expand a little bit on what that means?
Yes, for sure. So adaptive learning means that the platform is giving you the support you individually need. It's not like e-learning where you have one course, you have to start and you close it, and there's no flexibility according to the level of knowledge of each personal learner. So it's an individual tutor, an individual learning system helps you to close the gaps of what you don't know. Starting by a self-assessment yourself, you are rating as an expert or as a starter, and then you have to self-assess what you are answering, and the system, the AI in the back, is giving you analytics saying you're competent, you're conscious competent, or you're unconscious incompetent. And that is an important issue for the healthcare sector. We are here today as a healthcare conference. That means that doctors and nurses needs to know what they know and not what they believe to know. And this kind of paradigm shift and cultural shift is starting now in a kind of, I would say, a mini revolution of education, specifically in my area in the healthcare sector.
So knowing what you know and maybe more importantly knowing what you don't know and where you must improve, right? Yes. So how can we translate that into the healthcare sector?
We are just doing this. The healthcare sector is a big sector. We're talking about the academic sector, the clinics. We're talking about the healthcare industry, meaning the pharmaceutical industry, the medtech industry, or the IT industry. And we are just facing the problem that either the knowledge is doubling every 3 years. So what we discussed today also in the panel, that what to do with the enormous knowledge doubling. That means we need to find systems to educate people in a different manner. So, and we are also starting in clinics. Important for this GOFER and GHA meeting today is that we are starting a big project with the Saudi Health Commission with residents in training in internal medicine in Saudi Arabia. So that means that those residents who are starting to get into the board certification get through those courses. Why? They need to understand where they are unconscious incompetent and to move this to conscious competence. And we know from studies in the United States, where we're working together also in the Saudi Arabia with New England Journal of Medicine, which is the most scientific, high-ranked medical journal in the world. And they have a digital arm, and we are the platform partner of this digital arm that we tested with 4,000 pediatric residents shortly before they're getting the final board examinations, that nearly 25% were unconscious incompetence. So they believe, I know everything, I'm well prepared, but it was not the case. And we can reduce this from 25 to 12% by using this adaptive platform. And I think this is a huge step forward. But last but not least, we learned also today in the discussion that this is a cultural change. So we have the young talents and we have the old style people. So we have a generation problem as well. We have work-life balance, attitude changes, and so on and so on. And these all together brings us into a situation of change. And this takes time and trust.
Well, thank you. So there's lots to learn about learning and how to do it. So I'm confident that we can build on that in the future, especially with the help of your platform. Thank you so much for being with me today.
Thank you.
Thank you.